What would you prefer to be called?
Cecilia, my name.
Hey guys, Dr. Sil here. I'm a junior doctor working in Australia and I work in high security mental health facilities and I'm currently in training to become a psychiatrist. In today's video, we're looking at the YouTube channel Special Books by Special Kids. This is a YouTube channel I have not previously reacted to. I think I've seen maybe 2 of their videos before, but today's video is called Cecilia's Life with Hallucinations. In brackets, living with auditory hallucinations. Now, schizophrenia is something I see every single day, and I work with psychiatrists every day on trying to treat it. It is a very difficult to treat condition for some people, and it can sometimes feel like we're endlessly just trying to adjust the medications to find the right cocktail that fits this patient. But it is treatable. There is a strong hope for recovery, and I thought it would be interesting to have a look at this video and maybe make some commentary around a doctor's perspectives on Cecilia's reported symptoms and discussions around mental illness.
When you tell somebody that you have schizophrenia, how do you want them to react?
I want them to not be afraid of me and not to look at me any differently than they had looked at me before.
How often do you hear voices?
My hallucinations are almost 24/7. It's something that I just have learned to live with. I often say, I'm just someone who can't turn off my nightmares even when I'm awake. That's not a reason to be scared of me.
Thank you for...
Very interesting opening 30 seconds. The first thing to say is obviously this is someone who is well put together. She's wearing jewelry that matches her top, is well dressed. Her hair is done. There's good self-care evident. This is something that the Special Books by Special Kids channel does, this interview style where Chris sits next to the person. And I think it's to send a message of closeness and not being afraid of those who are different, because this channel is a channel that focuses on interviewing different people with different disabilities, different abilities and different walks of life. And so I think he does this to show that you don't have to be scared. You can sit right next to these people and that's fine. And these people are just like you and I and that kind of vibe. So that's probably a very good thing. I would never do this, I guess, as a, as a doctor. And I guess I would feel quite awkward. For me, this feels a little awkward to take this shot. To have a conversation side by side doesn't feel natural to me. And it's important to feel really comfortable. And I'm just noticing her body language is a fixed stare away, which might be a discomfort with the proximity of Chris, the interviewer. It totally could just be her baseline behavior as well. I don't know anything about Cecilia. But the other really interesting thing she's mentioned is just because my nightmares don't turn off during the day doesn't mean I'm any different. So there are interesting theories around schizophrenia, and it's important to remember that schizophrenia is just a list of symptoms. There's multiple different causes. It is a heterogeneous disorder, and there's probably going to be 50 or so different types of schizophrenia. Some more genetic, some more related to drug use, some more related to mesolimbic hyperactivity, some more related to mesocortical neural circuit hypoactivity. So, different neural circuits being in different activation states will produce different types of schizophrenia. And one day we'll have an imaging technology that can tell us all the different types of schizophrenia. But at the moment, we don't. But she's saying that her type of schizophrenia feels like a nightmare that doesn't end. And there are some theories that schizophrenia is kind of like a dream state. And if you think about it, when you're in a dream, you are pretty psychotic. First of all, you don't know that the reality you're in is not real, which is pretty common in psychosis. And you do magical, bizarre things all the times in your dreams. And so some people think that schizophrenia is just being awake while you're in a dreamlike state in the brain. So really interesting description from Cecilia. Now, auditory hallucinations are the most common form of hallucinations with schizophrenia. If people are getting more, it goes auditory, then visual, and then tactile, I think. Visual and tactile are more related to organic illness like drug use or medical issues like a delirium or, withdrawing from alcohol can do it. So it's usually, they're less common, but auditory hallucinations, very, very common. Sometimes they're just commentary hallucinations. Like as a doctor, when you're talking to someone with hallucinations, you need a quantify and qualify exactly what's going on. So it was good that he asked how often they occur, but you need to ask what the content is. How many people are talking? What are they saying? Are they telling you to do things? And is it associated with passivity? Are they controlling your body? Because if you have command hallucinations, which are hallucinations telling you what to do, they're derogatory, they're calling you names and telling you to hurt yourself and things like that, and they're associated with passivity, i.e. they can move your body, you're at high risk of suicide and hurting yourself or hurting others, because you have essentially someone else in your mind. You feel it like someone else is controlling you and moving you, and you listen to the voices because they're all powerful and all sorts of things. So those are the kind of things you need to ask about with hallucinations.
So honest.
No problem.
Have you had these hallucinations while we've had this discussion right now?
I don't answer that question. I've sort of made it as like a rule with myself not to really talk about whether or not am hallucinating at that moment, because then the first response is, oh, where is that hallucination? And then a common reaction is then everyone in the room looks that direction. I don't know why, they're not going to see anything, but that's just like the reaction. And that's very dangerous, because then you have real life interacting with your hallucination, and that could really hurt the psyche. My junior year of high
What a fascinating answer. So first of all, when someone tells me they don't want to answer a question, I praise them. I say, oh, good on you for setting a boundary and not telling me something you don't feel like talking about. That's healthy, that's important. And you never have to answer a question you don't want to answer about with me. That being said, if you're fully guarded and you don't tell me any information when I'm interviewing you as a doctor in a hospital, well, then I have to kind of describe you as a guarded individual, not forthcoming with information, and therefore that I can't make an assessment on you, and we have to treat it as high risk. So it's important to try and be as forthcoming as you can. But that being said, if there's like a trauma history, you do not have to re-go into all the trauma details and things like that. So I always encourage people to say, you're in charge. You don't have to answer questions you don't want to like, and you're allowed to leave the room at any point. I always say that. So you're in charge. You can leave the room at any point. And I feel that helps with violence and agitated, aggressive men, particularly who, they need a direction for their anger if they have an outburst. And if I just remind them that the door is one of those directions, they can just go out the door, then they're less likely to get angry at me. Obviously, Cecilia is doesn't seem to be a very angry individual, and has very good self-awareness. It's very enjoyable to work with people who have mental illness and good self-awareness and an internal locus of control. So something she's noticing there is she doesn't want to mix her internal reality, the hallucinations, with external reality, which is saying that she understands there's a difference. She's understanding that there is that these are hallucinations, which is that means the treatment is working well, because technically the definition of a hallucination is you don't know it's not real. And so a key question you can ask with auditory hallucinations is also, can I hear them? As your doctor in this room, should I be able to hear them? Because if it's if it's an auditory hallucination, you're hearing them like it's outside of your head, so you feel everyone can hear them. There's other kind of auditory hallucinations. They used to be called pseudo-hallucinations, but that term's not used anymore because it was felt to minimize the intensity. And these are voices that are inside your mind. You know other people can't hear these voices. You hear them as if they're in your head. You don't hear them like they're in the room, but they sound like someone screaming at you, saying nasty things, that kind of thing. And they're usually associated with a trauma response.
I started hallucinating a clown. It actually very much resembles the older adaptation of Stephen King's It. So it wasn't a good time.
That's frightening.
Yeah, it is. Was very, very frightening. I actually they thought that I've had schizophrenia all of my life. Like, it started out as shadows and whispers, and it just sort of developed into what I have now. But at first, I thought I was possessed. And let me just tell you, that's a lot more scary than realizing you have a chemical imbalance inside your head. So that's why I promote education so much, because it's often said that you fear what you don't understand. So me understanding more about my diagnosis makes me less afraid. My first time I ever...
So an interesting point around possession. In different cultures, psychosis manifests differently. So in some cultures, psychosis might look like a shaman or a healer or a mystical teacher, or they might think it's a possession. And it's interesting. I don't have an answer for this, but there's things called culture-bound syndromes, which are kind of like manifestations of what we think is psychosis in different cultures. And if that culture has a treatment for that psychosis, such as an exorcism, then as psychiatrists, we don't get in the way of that, as long as you also take the medicine for the psychosis, if that's what's been diagnosed.
Anyone outside of my family was my high school boyfriend. At this time, I didn't know what schizophrenia was, and I mean, I don't blame him. Neither of us knew what schizophrenia was, but I told him about the clown hallucinations, and he had never seen the movie It, so he ended up looking it up, and he actually thought it was more funny than scary, and so he kind of laughed it off, and I just, that really made it difficult to ever, like, I really did not open up until college then to anyone outside my family, because I thought, oh, if my boyfriend doesn't, understand, then a random friend won't. I lost control of everything, and that's what ended up resulting in the suicide attempt.
Would it be okay if I asked you a few questions about that suicide attempt?
Okay, I don't talk very much about it, but if I'm not comfortable, I'll let you know.
Yeah, let me know right away.
Okay.
Why did you believe that was your only option?
It's because I didn't feel like I could be the person who I wanted to be, and that people wouldn't accept me as a person, that wouldn't accept my diagnosis. Really, it's the worry of the real voices. Like, I hear voices in my head, but it's really the fear of what real people, like real voices, have to say than the ones I hallucinate in my head. Like, those are the ones that matter to me more.
What do you fear others saying?
I'm afraid that they will think of me as a freak. I have been called a freak. I've been called crazy. I've been called deranged. I've been called very nasty words.
What would you prefer to be called?
Cecilia, my name. I've joked that if there's...
I think she touches on a really important point here, which is that as humans, we just want to be accepted. We just want to be a part of the pack. And as mental illness awareness improves, it's really helpful for people with kind of conditions like schizophrenia to feel more accepted, to understand that it's not their fault, that this is genetic. And although there are environmental triggers that activate it, it is a genetic disorder in the neuronal pathways of the brain and the synapses between them.
Academy Awards for just acting normal, people who have schizophrenia would definitely be nominated.
So sometimes you're giving 100% of your energy and effort just to staying composed.
That is correct. That's why I also have to stay away from triggers. Trigger that I have is actually a lot of red and white. I have these hallucinations such as the clown, and I also hallucinate this girl, like from similar to like from The Ring, and she's the worst. Like, she has a knife, and she sometimes like stabs me, sometimes in the face.
Are conversations like this therapeutic for you? Do you hope people are able to have these, or would you rather just have them treat you as the person?
I think both. I think conversations like these are important, but then also I don't want every time I interact with that person to just be sort of their database of questions about people who have schizophrenia. Like, if I'm someone's friend, I want to be their friend. I've had a friend that actually said, I can't talk to you anymore because I don't know what's going on in your head while I'm talking to you. But I mean, do we really know what's going on in anyone's head when we're...
How eloquently spoken is Cecilia, and reflective and self-aware and aware of, like, that's right, yeah, like, you don't know what's going on in my head. I think that's probably more stigma than anything else.
Talking to them, you have that fear of people thinking that you're crazy. but getting that help is so important, and something that you really just can't. Don't let anyone get in your way of that, especially yourself.
If you could change one thing in your life, what would it be?
That's a really good question. I wish that I got treatment earlier for my schizophrenia.
Look, a key thing in getting earlier treatment in schizophrenia is knowing what the prodrome is. So sometimes schizophrenia is diagnosed in retrospect. So you have all the symptoms and then you get the diagnosis, rather than you get the diagnosis and then you experience all the symptoms. But there's usually a prodromal phase. So schizophrenia very commonly starts in the teens and 20s. So it's really at the end of the synaptic pruning. So for those of you who don't know, when you're born, up until 6 years old, you are essentially creating all of these neural pathways with heaps of synapses between the neurons, and all the neurons are just like a forest of bushes, just touching, communicating with one another. And from 6 years old onwards, all that bush gets pruned back into the most sensible pathways, the pathways you used most. And in someone with schizophrenia, there's a thought that there's problems in the synapses, the strength of the synapses, and the different pathways that are being activated and dysfunction there. Especially the dopaminergic pathways seem to be the common end pathway, and the cause might be in different areas of the brain, but the common end pathway seems to be the mesolimbic circuit, which is a dopaminergic circuit, and when is hyperactivated, gives the positive symptoms of schizophrenia, the auditory hallucinations, the paranoia, the passivity, where you feel someone's controlling your body and all that. But there are negative symptoms that can occur as a prodrome, as in the years preceding it. So usually what happens in the years before someone experiences the severe symptoms of schizophrenia is you get social withdrawal, you get poverty of content, so less thought content, you get anhedonia and apathy, so a lack of interest in things. So it's different to just a moody teenager. There's a kind of emptiness in the brain that starts. So that's the prodrome, but it's very hard to know if that prodrome is schizophrenia that's going to develop, or if it's depression, or if it's, that's quite tricky. And so that's why observation is very important in the treatment of mental illness. But one day, hopefully, we'll have a blood test or an imaging. I think it'll likely be an imaging modality of the brain that'll show the kind of hyperactivity and hypoactivity of different neural circuits that are associated with a schizophrenia development, and therefore you can treat earlier. But yes, so treating psychosis early is important. The longer you leave it untreated, usually the harder it is to treat. And if you have more relapses because of non-compliance with medication, the next relapse of psychosis usually needs stronger medication, showing that there's a neurodegenerative aspect to it. So schizophrenia is also neurodevelopmental, so it's a problem in that pruning and the synapses and the formation of the networks in the brain, but it's also not only neurodevelopmental, but neurodegenerative, whereas untreated psychosis does lead to a progressive worsening in cognition, in mental state, in brain function.
Because I look back at, especially when I had the suicide attempt, of just really the fear of the diagnosis and the fear of the stigma just paralyzing me. I wish that I didn't have that fear.
Another point, with suicide, 6% of people with schizophrenia will die by suicide. Not attempt, die. So it is the most common cause of premature death in people with schizophrenia. It is way more common than in people without schizophrenia. It's really horrible. You have to. So the big risk factors for suicide attempts are substance use, so a dual diagnosis with schizophrenia and substance use, but also if they're experiencing a depressive episode. So it's not just because that you have schizophrenia that you can't have depression. So if you have schizophrenia, command hallucinations, low mood, depression, those voices telling you to kill yourself, plus substance use, which can make you impulsive, it's a horrible cocktail for a very bad outcome. So if those things are happening, they need to go to hospital ASAP.
If somebody wants to be your friend and connect with you, what's the best way to do that?
Just be genuine. I guess just be nice. I don't have a good answer. answer to that, just, I don't know, play games with me when I love playing games. For example, when I feel down, my roommate plays board games with me.
That's a
Just
nice
being able
roommate.
to interact and have those type of moments where we aren't on like electronic device. Like I don't have a phone. That's a pet peeve of mine, is if people are like staring at their phones. So just having those genuine, like, old I sound like an old person, but like board game night.
How are you able to separate
I love a good board
reality
game night.
from those hallucinations?
Meds.
I'm very lucky that the things that I hallucinate are not usually things that would be in regular day life. The exception to that is I sometimes hallucinate spiders, and the small spiders are the ones that I have difficulty with, because we see little spiders in everyday life. So that's the only time I have a difficulty discerning whether or not it's a hallucination or not. However, if I'm, say, hallucinating a giant spider, one comes into mind, this like large spider with like leathery skin, yellow body, black legs, and like when its legs moved around, no voice came out of its mouth, but like the creaking of the legs sounded like children laughing.
Wow.
Like that's not something you'll see in everyday life. So
Do you see that often?
spiders are some of the more common things I see. I really will not rest until anyone who has schizophrenia anywhere worldwide is not afraid to say the words, "I have schizophrenia."
What's something that's important for the world to understand about you?
That I'm not a monster, and that I'm more than a plot twist in a movie, or that conversation people have after a mass shooting. Again, people who have schizophrenia are more likely to be the abuse victim rather than the abusers. The good guys get schizophrenia too, and the majority of them are good guys.
So a final point to make there is that she's experiencing a significant amount of hallucinations as visual hallucinations, which is less common in schizophrenia. And it does happen, but it just warrants a thorough organic workup. And what I mean by that is looking at other causes of things that can either cause hallucinations or exacerbate hallucinations. So things like drug and alcohol is common, but medical disorders like Wilson's disease, problems metabolizing copper, autoimmune encephalitis, so autoimmune attacks on the brain cells, and a host of other things can cause psychosis and visual hallucinations. So you need to do a medical workup with imaging and blood tests and this and that and the other, and so it's a bit of a process, but it's important to do, especially in a young person who's having their first episode of psychosis. And family history can be very helpful as well. Like if you have a parent or two parents with schizophrenia, it's a very high chance that you will get, well, if you are having psychotic symptoms, that it is schizophrenia. It's high chance that is what's happening. But if you have no family history of psychosis and you're the first one to have, psychosis in your family, well, you should probably look at other possibilities. It definitely happens, but you got to look at the other possibilities. Anyway, that is it for today's video. I hope you found it interesting. I definitely found that talk with Cecilia just fascinating, and she's so well-spoken, reflective, and she's so social. She gets so much of life's value through a connection, which is not always the case. Some people with schizophrenia have less social interest. And if there's any other videos you want me to react to, just leave a link down below in the comments section. Please support the channel just by liking the video and sharing it with a friend and subscribing to the channel. And other than that, I wish you all just a wonderful day, and I'll see you all in the next video. All right, bye for now.